Now, Dr. Quinlan, Lightheart, Jagged, and Dorrity have enumerated several ways in which a patient will lose under a national compulsory health insurance program, and why this is so. Essentially, they have brought out facts based on the knowledge of such systems in other countries, that government medicine is inferior to medicine under the private, free enterprise competitive system, and that government medicine is much, much, much more expensive. They have told you why this is so. For the past 300 years in America, there have been laws pertaining to control of certain medical problems dating from the colonial laws for caring for the indigent, sick, and the laws on quarantine. However, in America, until the recent past, there have been no laws interfering with the basic essential of progressive, private, personal, free enterprise medical care, the doctor-patient relationship. Socialists in this country have nurtured on the experiences of countries with compulsory sickness schemes, government health insurance, since January 1884, when Bismarck came forth with his great discovery, which consisted in a device for making political capital and poverty out of poverty and human suffering. Ever since Bismarck, great dictators and little demagogues have competed with one another and with the humanitarians in courting the favor of the ailing, the lame, the blind, the poor, the underprivileged, and the aged. Now, I had first thought we might have time for questions from the audience, but we're getting way behind, and I don't think we better stop at this. But anytime you have some questions you want to ask of this audience after the program is over, please come up and talk with them. Ernest Freund, F-R-U-E-N-D, professor of law in Chicago, said, "Let the advocates of health insurance agree upon a minimum program and urge the adoption of that. The well-known expansion tendency of relief legislation may be relied upon to take care of the future." Labor liberals in government and socialists have certainly followed this advice. Since the effort to totally socialize medicine was attempted in America during World War II, this attempt having failed, they backed up and have now been nibbling away ever since in a piecemeal manner. Socialists, including Wilbur Cohen, Walter Reuther, and the former Secretary of Labor, Francis Perkins, and others, knew what each of these steps would mean. The Hill-Burton Law, the Medicare Act dealing solely with dependents of the armed services, presentation of the Foran Bill, the Kerr-Mills Law, AMA's effort with elder care, in which they got AMA to finally begin to compromise. They and the liberal advocates of government-dictated medicine knew that passage of the Medicare-Medicaid law was a step toward national health insurance program. Dr. Quinlan has told you the ways that labor, liberal government, and government bureaucracies are building up propaganda for national compulsory health insurance in his company. And I'll only talk a little bit about it. The well-publicized public cries for change seems to be coming entirely from a few politicians, socialists, reformists, and journalists. In none of the countries where compulsory health insurance has been adopted was there a majority actively in favor of it. A small number of uplifters, for the want of a better term, associated with a few shrewd politicians, put the schemes across in nearly every instance. And talking about the propaganda, we'll mention a few. That is that we now have a massive health crisis and a doctor shortage. And incidentally, regarding a doctor shortage in the United States, we have one doctor per 650 people, and this is far more than most of the other countries that now have national health insurance. That medical costs are too high. And Dr. Lightheart reiterated that it'd be $2,000 per average family if you get the adoption of the Kennedy and Labor's program. Health care is not reaching the bulk of the population. Of course, this is absurd, because when in a congressional testimony once, they tried to find out how many Americans were being denied medical care or could not get medical care, and not one individual could be uncovered who could not get or was denied medical care if he attempted to find it. If the reference is to the ghettos, who in his right mind would want to go into an unsafe area? Areas where it's even unsafe when you have guards with you. However, the ghetto people can be gotten out of and into hospitals and clinics and medical centers that are only a few minutes or a few miles away. It is only human and reasonable for doctors to locate where they can practice a profession in safety, where they can make a living, and where they want to live and where they want to raise their children. Government compulsory medical care will probably not alter this very much. And the claim that doctors are unscrupulous, and this has been brought out, and where they cite examples of doctors who have just made a killing under Medicare. Well, the facts show that only 5 doctors out of 338,000 have been convicted of fraud in the history of Medicare and Medicaid. What has really happened is that government is now having to pay for what doctors were doing as charity, what they were giving away. The doctors are now beginning to file claims for payment of these people, treatment of these people that they once cared for under charity because of the Medicaid and Medicare program. The sixth one is that the country is on the brink of medical disaster, that we have wretched or poor medical care. Strange that other countries under national compulsory health insurance readily admit that we have the finest medical care. Ours is the envy of the world, acupuncture notwithstanding. The constant propaganda that the government control is inevitable. Yell a lie loud and long enough, and it will eventually be accepted as the truth. This, incidentally, is getting to some of the doctors. You see, many doctors have not done their homework in learning about socialist activity and propaganda. And I'm quoting now, the propagandists from National Health Insurance have leveled their attacks on your doctor and on his system of private medical care. But if National Health Insurance is enacted, it will be you, the patient, who will be the victim, and I'm quoting from Marvin Edwards. J. and Art Power made it quite clear that when a service is made free or nearly free at the consumer level, there will be no limit to the demand for it. Of course, the demand cannot be met, as Dr. Quinlan mentioned. For example, as a comparison, suppose General Motors announced that they were making Cadillacs free to all who wanted them. Do you suppose that General Motors could possibly supply the demand for Cadillacs? Of course they couldn't. Compulsory national health insurance systems in other countries have tried to meet the demands by, as Dr. Quinlan mentioned, having long waiting lists, deductibles for drugs and on services, classifying types of patients being seen, treated, or hospitalized, penalizing physicians with limitations on drugs that they can prescribe and charging them if they vary. Remember, Medicare is not all free. Remember the deductibles. Compulsory health services have been used in all countries to augment and strengthen controls by politicians and bureaucrats. The socialist bureaucrats have one thing in mind for all Americans and for the medical profession in this country: total socialized compulsory medical care. The abolishment altogether of a compulsory sickness scheme, once established, even if bankrupt and unsatisfactory, is beyond imagination. It never has been done. We cannot afford such a system of medical care, medically or financially. We must not allow it to happen. Thank you.